Emetic agents are basically agents that cause vomiting. The mechanism of action, the action is local on the gastric mucosa. On the central aspect, it actually triggers the chemoreceptor to induce vomiting. Therapeutic effect is obviously induced vomiting, and most commonly given, right, or the main reason why we give it is because of poisoning. Some precautions, they must ensure that they know the cause of poisoning before administering, and some contraindications to this drug is lethargy or comatose client, right? Even after poisoning, you don't want to give something orally when a patient is not very conscious or may not have the ability to swallow that medication. And in addition to that, another contraindication is absence of a gag reflex. Why? What can happen? Well, what can happen is it can cause the patient to aspirate, right? So that is not good for the patient. So we need to make sure they're awake and they're able to swallow the medications without problems with their gag reflex. Some side effects that we need to be aware of. So CNS depression, so central nervous system depression, so that can cause some altered mental status, right? Decreased consciousness, dysrhythmias, and diarrhea. Some nursing actions include ensuring that it is a correct treatment, right? That the treatment is appropriate. And again, we need to make sure that we protect their airways, especially if we know that this medication is going to induce vomiting. So are they able to manage those secretions? What if the secretion comes up? Are they able to spit it up or spit it out? Or will they choke on it and cause more problems such as respiratory problems or respiratory failure? So those are the things that we need to make sure and check, and obviously therapeutic effects and possible side effects. So lastly, the example or the drug that we need to know in this class is Ipecac or Ipecac syrup. So this is the medication. This is actually derived from some roots. So this is a naturally occurring drug. Just so you know, there is lack of evidence or supporting evidence that this is actually effective in treating poisoning. So this drug is actually no longer recommended for poisoning, although that's the common reason why it's given. This is no longer recommended for poisoning, and currently activated charcoal is a treatment of choice when it comes to poisoning. And the reason for that is that this medication is ineffective in poisoning based on some studies. So over many years that this has been used, there was no significant or sufficient evidence supporting that this medication that induces vomiting actually prevents the effect of poisoning. So again, you may actually hear about this medication, you may see it being used in certain situations, but this is no longer a drug of choice when it comes to poisoning. And one thing also to remember, please do not induce vomiting when it comes to chemical poisoning.